Hi, Dr. Shirazi. Welcome to the Genetic Genius podcast. I am so thrilled to have you as a guest today.
Thank you so much for having me, and thanks for accommodating to our schedules. Yeah.
Right. Yeah. We've both been all over the board, but now we're here
Mhm.
together to talk about sleep, which I'm so excited about. Before we jump into under the covers, could you just tell us a little bit about you? I'd love for the listeners to kind of get to know you,
Oh,
about your passion, what you're doing here on the planet to make a difference.
yes. Yes. Well, I find and I always joke, but I'm serious. I do it for purely selfish reasons because it makes me feel good to help people get out of chronic pain and to help them just have a nice, quiet night's sleep, get out of
Mm.
snoring and sleep apnea, and just have a good night's rest because sleep is so essential to survival.
Oh, totally. It's one of the key pillars, right? Without that,
It
nothing
is.
else really works.
That's right.
Yeah, and
It's really true.
yeah, so true. And you're based in California, that's correct?
I am. I'm in the Los Angeles sort of area. I have one office in Brentwood, and my main office is in Thousand Oaks, California.
Oh,
Kind of like
nice.
between LA and Santa Barbara, kind of a nice hilly
Beautiful.
area. Yeah.
Yeah. Oh, nice. I love California. Well, that's great. And I'm so glad to have you here to help our listeners to tune into how they can help themselves with better their sleep. And let's
Yes.
start kind of like at the basics, if you don't mind. Like, are there specific criteria that you look at for diagnosing a sleep disorder in general when someone comes into your office?
So, in the context of sleep apnea,
Mm-hmm.
I always want them to have a sleep study done first, right?
Mm-hmm.
Whether in a lab or just a home sleep study. Some doctors don't like the home sleep study. And I understand if you have more serious medical conditions like narcolepsy, insomnia, and things like that, an in lab will give us way more data. Like
Mm-hmm.
there's way more data in an in lab study than any blood panel, than any
Mm-hmm.
blood test. But a home sleep study gives us the pertinent information to help us diagnose and see what's going on in their airway. So we
Mm-hmm.
have a physician interpret that sleep study, and then if it's something within my wheelhouse to help, then I do. And the treatment for adults and children is totally different.
Mm-hmm.
In adults, I'm typically making an oral appliance that holds their airway open at night from collapsing. And for children, we're usually doing what's called functional orthodontics,
Mm-hmm.
which is something that we know can literally cure sleep apnea.
Oh, that's great. There's
Highly,
that option. Oh, sorry.
yeah, yeah. No,
Yeah.
no, you're absolutely right. Yeah, but I'm grateful that that exists.
Yeah,
Yeah.
totally. So I didn't really know, I didn't realize there was an at-home option. That's really interesting. But from what you just said, it's more reliable, much more data that we can have when we are looking at that results from the in-house sleep study.
In the in lab, you get more data.
I mean,
This is
in-house,
this
in
is
lab.
what I tell my patients, because there's always the factor. It actually has a name called the first night effect.
Mm,
It's actually a factor of not getting a normal night's sleep in a sleep lab, right?
right.
And so what I tell my patients is when you go out of town and you're staying in a hotel, when you stay at that hotel, are you usually so tired that you just put your head on the pillow and you're done? And
Right.
if they say yes, then I would say, well, an in-lab study is going to give us a lot more data, right?
Right.
But if they say no, it takes me a few days. Like I'd say anecdotally, I would say 75% of my patients would say, no, I need a few nights to get used to the bed, the room, the air conditioning, the noises, all that, before I'm able to get a normal night's sleep. For those patients, I go, well, maybe you should consider doing an in-home study because
Right.
you're going to get a more realistic data as to what's going on in your own bed.
Right, because when you're in that your own environment, then you're able to get a different type of data as if you're on vacation and you can't sleep for days.
That's right.
Yeah,
Not a
yeah,
normal
that
night's
makes
sleep.
total sense. And what are some of those, what are you looking for in that lab work? Like, what's the data look like that you're explaining to your patients? Like, this is what's showing that you're having sleep apnea or you're having some
Mhm.
disorders in your sleep.
Right. Excellent question. So, three main things. So the definition of an apnea is when we hold our breath for 10 seconds or longer.
Hmm.
And hypopnea is where we're breathing, but it's shallow and it
Mm-hmm.
causes the oxygen to dip 3% or more,
Mm-hmm.
right? So, somewhat the score that we give the severity of someone's apnea is when we combine all the apneas and the hypopneas and divide it by the number of hours they slept.
Oh,
Okay.
that's so interesting.
So in adult white males, 5 or less an hour, we consider that within normal limits, 5 to 15 mild, 15 to 30 moderate, and anything over 30 we consider severe.
Mm-hmm.
Now, there is a third aspect called upper airway resistance syndrome, which is we don't hold our breath for 10 seconds. It's less than 10 seconds. And the shallowness in our breathing doesn't cause oxygen to dip significantly.
Mm.
But critically, as we kind of get out of it, we basically snort. It's almost like snoring, with
Right.
like that. When we
Right.
do that, our brain waves get
Mm.
kicked out from a deep stage of sleep to a lighter stage of sleep for 10 seconds or more.
Right. And then
That's
we're able
called
to
an
wake up
arousal.
more. Mm-hmm. Yeah.
That's called an EEG arousal.
Yeah.
And the reason why that's so critical, and there's distinction, is when we talk about sleep apnea being tied into virtually every inflammatory disease that exists, it's actually the arousals that are causing the disease process way more so than the oxygen deprivation for most people.
Wow, that's fascinating. So that data is really key for you seeing if someone might be suffering from not only that sleep disorder, but if it's also really highly connected to their inflammation pathway and why they're having a chronic pain cycle.
Yeah, and not just pain, but any other kind of issue, because we know that insomnia, depression, anxiety can be strongly linked to those arousals,
Mm-hmm.
right?
Mm-hmm.
And it is, we don't even know, if it's the cart before the horse sometimes. So for example, something that can happen, it's not common, but something that can happen is someone can be woken up by their choking, by their apnea. And it's even possible that they don't have very many of those apneas. However, one of them was very long and they woke up just gasping, right? And that can lead to a very frightful situation and they have a PTSD from that.
Mm-hmm.
Well, that PTSD from that, you want to call it an arousal, can lead them to having an insomnia where they wake up at around the same time of night that they had that frightful episode,
Mm-hmm.
right?
Mm-hmm.
So, one can feed into the other or the other way around. They're also intricately linked that it's very hard to separate them.
Right. Yeah. Fascinating. And with the community that I work with at the veterans farm, I see that a lot with that PTSD
Oh,
scenario that
yes.
you're talking about, because they often have the same recurring dream, and then that dream and or nightmare wakes them up so often in the night that they have such frequent insomnia, and I can see how that cycle would be very challenging.
Yeah, I find it absolutely tragic. So we have a mental health crisis in America now that's compounded by the fact that we have very poor access to care,
Mm-hmm.
right? And the reason why, and the thing is, it's not talked about. It's like the elephant in the room,
Mm-hmm.
right? So depression and anxiety are very, very high right now in society. And PTSD, I mean, and I know the subject of school shootings and mall shootings and any kind of shooting
Right.
is a very sensitive subject. Like, and by the way, I don't have a political affiliation. I don't classify as a Democrat or a
Right.
Republican. I just find all of them as corrupt personally.
Yeah, it's just
Um,
giving your 2 cents worth.
This might do that. I guess that is a political affiliation to say they're both corrupt, but that is how I feel.
Right.
It seems like the left is hell bent on blaming the gun, right?
Hmm.
And the right seems hell bent on defending it for whatever reason, for every little thing. And the crisis is, if we know that between 42 and 47% of the American population have guns in their household,
Hmm.
and even though we have a lot of these shootings, it's a very small percentage to the actual people that have it. When we also look at that percentage that has done those acts, those
Hmm.
criminal acts, they are, I mean, which shouldn't be a surprise, they are in a very bad, very poor mental state. They are
Right.
riddled with PTSD. They have mixed mental health treatment with
Mm-hmm.
mixed levels of psychotropic medication,
Mm-hmm.
some of ranging from not at all to not enough to too much, right?
Right.
But there's always the mental health issue that's right in the center of it,
Mm-hmm.
right? And I don't understand why we keep ignoring this. It's
Mm.
really is the elephant in the room, and until we address it, we're just going to be shouting at each other
Right.
about the problem rather than focusing on the cause. And our poor homeless veterans, we send them off to war. They come back with this trauma, and then we just sort of like, toss them aside.
I
It's
know.
absolutely
Heartbreaking.
tragic. It's
Yeah.
heartbreaking. And if we can just help them with their PTSD, that might go a long way into getting them back on their feet. So here in the LA area in Santa Monica, we actually have the Santa Monica, it's a branch of the Santa Monica Police Department, has a very good homeless outreach program.
Mm-hmm.
And what they do is they scoop them up and they take them, I think it's over either Fresno or Bakersfield, and they try to get them cleaned up. They
Mm-hmm.
try to find them their family members. They try to reunite them, try to like help the connection happening. They try to find them work, get them a shower, get them clothes, get them mental health care.
Right.
And what they find, what the people that do this wonderful work have told me, is that they're able to help about 50% of them.
Mm-hmm.
About 50% of them, they're able to connect them with family that they lost, or just, give them an opportunity to get back on their feet and get a job, right?
Right.
And the other 50%, their mental health state and the PTSD is such a state, so severe, that they choose not to take the medication. They choose not to really do anything about the trauma. And they just basically like panhandle their way through a bus back to the same corner that they were at in Santa Monica, right?
Wow.
And they just sort of stay there. So that aspect, that PTSD aspect, and their ability to, you know, get a good night's sleep so that they can recover better
Mm-hmm.
is such a critical part into their overall health and everyone's overall health. I mean, Lord knows how many people have PTSD after what happened last year,
I know. Right.
after it happened
Exactly.
2020.
Yeah. Have you seen a large increase? I totally agree with all the things that you said, because I know
Mhm.
that's such a huge aspect of what we're missing in our healthcare. And my question on top of that is, have you seen this huge shift in your practice of, even just in the last 6 months, of people having more insomnia, having more sleep disorders, have, because of that PTSD you just mentioned, and the extra
Yes.
added like level of stress that they've never dealt with before?
Absolutely. So, for example, one of the causes of TMJ disorders, one of the main causes, is clenching your teeth at night, clenching and grinding.
Mm-hmm.
So when we do that, we know that 50% of the time it's because of sleep apnea.
Mm-hmm.
And the other 50% of the time we just say stress, right? But when we look at it, and it's a very broad set of literature, and I probably haven't even hit 10% of it. It's so broad.
Mm-hmm.
Um, it's any kind of autonomic nervous system stress. So if you have a food allergy or sensitivity to gluten and dairy, which so many people do,
Right.
and you have a slice of pizza before you go to bed,
Uh-oh.
you're going to clench your teeth,
Right.
right?
Yeah. I do
And
that.
when, right? Okay, so you
Yeah.
clench your teeth. And,
Right.
emotional stress can make you clench.
Mm-hmm.
And we feel that the aspect, like, so in those studies where we find 50% clench because of apnea, we'll see their airflow start to go down.
Mm-hmm.
And, but again, no loss of oxygen and no solid apnea. It'll just get low. And then we'll see the muscle activity and their masseters go
Mm.
up.
Oh, it's
And then
interesting.
when we see their airway restored again, then the masseter activity just drops.
Right.
Right?
So that back and forth of clenching and relaxing.
Exactly,
Hmm.
exactly. So it must be some kind of built-in, centrally mediated phenomenon that evolution deemed as important. So, for example,
Right.
when we transition from awake to sleep
Mm-hmm.
and to the different stages of sleep, we
Mm-hmm.
tap our teeth together, like we just tap them together. We don't know why still. There must
One of
be a
those
reason.
strange phenomenons. Yeah.
Yeah. So it's all sort of related. So what I've been finding is people who are on the fence about coming in, they are
Mm-hmm.
now clenching so hard that they can no longer be on the fence, right?
Right. Yeah.
And my patients from 10 years ago who probably needed a new appliance for their clenching anyway are now just biting through these old
Mm.
appliances, and they're like, oh my god, I need a new one right away.
Wow. Really
You know.
having some clenching going on
Yeah,
there.
and the technology has changed for us. So we now have, I mean, not in my, the machine costs $250,000, but we actually have machines that will 3D print from a hypoallergenic nylon a
Wow. That's so cool.
material that basically doesn't wear and doesn't break. I mean,
Mm.
with rare exceptions.
It's like for the rocket ship, right? Like
You
something so
know,
strong. NASA made it, right? They always make the best stuff.
you're right. But it has to be, for our uses, it has to be FDA approved for intraoral use, and there's
Right.
very few products that have that FDA clearance.
Right.
And the fact that we can and then now we scan it. So if they lost it, or their dog chewed it up, or they left it in a hotel on vacation, we just call up the lab and go reprint,
Right. Super
because
easy.
we have
Mhm.
the data in the hard drive.
Yeah. Oh, that's great. I love that. I'd love for us to kind of re-step back a few steps. And you mentioned the stages of sleep, and I'd love for you to talk about that because I think that's really important for the listeners to kind of tune in and
I
see,
think so too.
where they are in that state, in those stages of sleep, and if they're having some disruption in their sleep cycle.
Yeah. So the first stage is alpha,
Mm-hmm.
and we go into alpha every time we close our eyes.
Mm-hmm.
And it's just a mild state of relaxation. Okay. Both mental and physical, but mild.
Mm-hmm.
Uh, Second stage is that's the one stage we know the least about. Okay. It
Mm-hmm.
must have a function. I don't know if we know all the functions associated with it. The third stage we call delta.
Mm-hmm.
Okay. This is where we get almost 100% of all our growth hormone.
Super important.
Super important. That's for physical, repair.
Mm-hmm.
So while we're in our growth stage, like let's say birth to 18, birth to
Mm-hmm.
20, that's for us to grow.
Right.
After the age of, let's say, 20, a little bit younger in females, but after that stage, it's for the repair of our
Mm-hmm.
tissues, right? So
Yeah.
we, like, if we go to a workout or a gym or a triathlete or whatever, we need that delta to help
Yeah.
repair from our injuries. And then, of course, the stage that everyone knows about, REM stage sleep,
Yes.
rapid eye movement.
Mm-hmm.
So with REM, that's associated, and we're still learning, it seems like every day, all the
Mm-hmm.
benefits. So with REM, we're doing our mental and emotional processing
Mm.
of the events of the day. We're doing our memory consolidation.
Mm-hmm.
And one of the things we're finding is that our brain has a lymphatic system of its own.
Mm-hmm. Mm-hmm.
And it's during REM where we're clearing out the beta amyloid plaques in our
Mm.
brain, in our vasculature
So
in our
key
brain,
for preventing dementia. That's amazing.
dementia, and even
Yeah.
strokes.
Mm-hmm. Wow, that's great. What
Yeah.
part of those stages does meditation, let's say you're doing maybe even short or long-term meditations, like a 5 minute or 15, what stage are you going into there?
It depends on your on your skill level, right?
Okay,
So
right.
most people, I believe, go into alpha,
Mm-hmm.
right? The beta is when we're awake,
Mm-hmm.
and I hate to sound like a downer, but that's our thinking stage.
Mm-hmm.
So sometimes when we try to meditate, we end up just thinking thoughts, and
Right,
we stay in
ruminating.
ruminating, and
Yeah.
we end up staying in beta.
Yeah.
And those that are extreme skilled meditators go
Mm-hmm.
into theta, which is the same as when you're in REM.
Right.
Really good
Wow.
question, by the
Mm-hmm.
way. So, like the Buddhist monks
Mm-hmm.
who are like, Nepalese monks
Right.
will get into theta. They've been tested.
That's awesome. I want to be tested for meditation. That's
Yeah.
my next adventure.
I tried to do it. I actually did when I did a sleep study in my own lab.
Mhm.
We were in the middle of a research study. My sleep lab is mostly for research. And we were in the middle of a study and one of our machines crapped out. And
Mm-hmm.
so while a new one was being sent over, they sent us a loaner.
Mm.
And of course, we couldn't use the loaner on a research subject without testing it first.
Right.
So I said, all right, just do the study on me.
Yeah.
So I did the study on myself. And, when I woke up in the morning, I said, "Hey, let me know what brainwave I go to. I'm going to try meditating." Right?
Yeah.
I just went back to sleep. I was so tired, but I wanted to know. They just laughed
Right.
at me. That you were just an alpha.
You were
Yeah.
just sleeping again. That's
Yeah.
funny. Yeah, I mean, like you said, it really probably depends on your skill level, how often you're meditating. And because it's just like anything else, like riding a bike. You can't just be like, I'm just going to go right into it. You do have to have that practice.
Right on.
Yeah. And are there particular lifestyle factors that contribute to poor sleep patterns and sleep hygiene?
Yes, I was just going to lead into that would be sleep hygiene. So the things that I give a handout to my patients. So to me, the most important thing is that the bedroom is dark
Mm-hmm.
and cool,
Mm-hmm.
and you keep your head where your brain waves come from
Right.
away from too much electricity. So
Mm-hmm.
I don't have a television in my bedroom.
No, not a good idea. I tell
Much
my patients not to do that too.
much to my wife's complaining, but we don't have one in our bedroom. We don't have, like, I put my phone in airplane mode.
Yep.
Even though it's my alarm clock, I put it in airplane mode. And if it's possible, I try to put the headboard of my bed away from electrical outlets.
Oh, that's a smart one. Yeah,
Okay.
we'll have to look at that in our room.
Yeah. I want to tell people to maintain their bedroom
Hmm.
as a place of sleep and sex only.
Right. Not like
Okay.
you, whatever
No
else you're doing.
eating,
Yeah.
no eating, no family gathering spot.
No
And I would even,
fighting.
and that, thank you. That was the next thing I was going to say. Avoid your arguments in the bedroom.
Yeah, not a good one.
Not a good one. Yeah, do it in the kitchen or do it in the dining room. So those are my main points. Having proper nasal breathing. So if you're in a
Hmm.
very dry climate, you want to have a
Hmm.
humidifier.
Hmm.
You want to make sure your nose is clear so that you're not mouth breathing.
Right.
Yeah, those are my main, most important points when it comes to sleep hygiene.
Yeah, so key, so important because we need those particular factors. And do you have something like an intake form when patients are coming in for those lifestyle factors that they're checking off?
Hmm.
Like, okay, I have a history of anxiety, or
Hmm.
I'm sleeping with all of my EMFs all around me, something like that.
Well, we ask. Of course, we
Hmm.
ask. And the thing that people seem to be most sensitive to is having their animals on their bed or even in their
Mm,
bedroom.
right, like dogs
So,
in the middle of
like
the
dogs and
night.
cats and all that.
Yeah.
See, the problem is just like a neighbor's noisy dog or a noisy street, if you have a dog that like wakes up, moves around, barks, or even just jostles or
Mm,
kicks you or whatever, or they have REM sleep too, and they
right.
sometimes act out in their dreams. That will cause an arousal. That
Hmm.
will kick you out of the deep stages of sleep, which is what you don't want,
Right. Yeah, you want to
right?
stay in that deep sleep.
Absolutely,
Hmm.
absolutely. So that's one of the things that I tell them. It's like, well, if you can manage,
Hmm.
try to keep your dogs out of the bedroom. The dogs aren't going to like it. I've never had a patient say no problem.
Right.
most
Yeah,
of the
we'll just
time
kick him out the
that
room and lock the door.
most of the times they get upset. They're like, we're not going to be friends very soon. It's such an
Right.
important deal with them.
Yeah, exactly. What about the hyperbaric oxygen chambers? Are those helpful for sleep?
I've never heard it used for sleep or sleep apnea personally. They're wildly successful for stroke and myocardial infarction and even in drowning
Mm,
victims.
right.
I've actually seen case studies where children like recovered from drowning where they had like brain trauma
Mm-hmm.
and even like oxygen deprivation to the brain.
Mm-hmm.
And with hyperbaric oxygen therapy, they've made full recoveries.
Wow, that's amazing. That's wonderful that that can be helpful with that. Yeah, I was just curious. I don't know a lot about that treatment, and I just had a little thought about it. I was like, I wonder if it helps with sleep because we do have a center here where I live that, and I know it's becoming more popular.
Well, I mean, it depends. So I would be very open to seeing if there's any literature, because I don't know if you can spend the night in a hyperbaric
I
oxygen
don't know
chamber,
that. Yeah, I don't know if you can have that
because
long.
you can have too much oxygen. Your body can get used to it. You don't want
Right.
that. One of the causes, so there's a form of sleep apnea called central sleep
Mm-hmm.
apnea, which is not an obstruction. It's actually your brain telling your body not to breathe.
Oh,
And
interesting.
so that can be caused by, inappropriate morphine drug
Mm.
uptake,
Mm-hmm.
but much more commonly, it's caused by mouth breathing
Mm-hmm. Mm-hmm.
because we just get rid of too much CO2 by mouth breathing,
Right.
and we need CO2.
Yeah,
CO2
it's
is
important.
really important. So the brain will actually tell the body not to breathe,
Mm-hmm.
so it builds its CO2 back up.
Right.
So if we're in a chamber that kind of keeps the CO2 in there, I don't know how someone would respond to that. I wouldn't want to. I wouldn't want to try it. I would. I
Right.
would. I would want to be monitored during the day, half hour, hour in the machine, bringing in kids into the machine. I have no problem with it at all. But everyone's different,
Right. Yeah, this
you
is
know.
true. We all have
And
different
COVID
aspects.
times, COVID
Mhm.
times, we're finding that oxygen therapy on its own is
Mhm.
extremely helpful,
Mhm. For the
even in long
respiratory
haul
system.
patients. Even in
Yeah.
long haul patients. So,
Mhm.
so I think that aspect will go up in time. I think people will be
Mhm.
more and more intrigued by that over time.
Yeah. Well, I'm gonna look into it a little bit more myself. How does sleep affect the way the cells function? Like, for instance, mitochondria and things like that. Does sleep have a huge impact on the cellular function and specific organ systems?
So yes, it does. So sleep affects everything. There's nothing that sleep doesn't affect. There's no physiological function that I know of that isn't either directly or indirectly affected by sleep. Like, so for
Mhm.
example, there's even studies that show that patients that have cancer and previously had sleep apnea have
Mhm.
a 5 times more likelihood chance of death if
Mm.
they have that sleep apnea while they're dealing with the cancer,
Wow, that's
right?
a huge
That's huge.
difference.
If it was a 1.2%, well, I'm sorry, 1.2 times
Mm.
increase in death, that would be a red flag. But a
Right.
fivefold
That's huge.
is massive.
Yeah.
So to answer your question, so the purpose of mitochondria is to generate ATP for the cells. Yeah.
Mhm.
And I don't know if we know all the reasons why ATP needs to be triggered for the kind of mitochondria to make. Like, I
Mhm.
don't know if we have it all figured out
We're still
of the
figuring it out.
because you understand the mitochondria have a totally different DNA than our
Mhm.
cells, right?
Right.
So we merged with them at some point evolutionarily. We merged.
Right.
So there has to be a signaling from the
Mhm.
nucleus of the cell to the mitochondria. And when we have a global issue like sleep apnea,
Mhm.
like retardation in our sleep waves, it becomes a major problem.
Mhm.
Or how do we tell the mitochondria we need more energy right now,
Right.
right?
Hello.
So what we do for our pain patients, we
Mhm.
use a specific laser. We have many lasers, but almost all of them will trigger the mitochondria to make more ATP. That's the
Mm.
main function.
Mhm. Like a cold laser?
Like a cold laser,
Mhm.
like we
Mhm.
use that to help the body to help repair itself in this
Right.
region. Yeah.
Yeah.
So in a sleep apnea situation, I couldn't tell you with certainty because we have so many different tissues and they all have mitochondria,
Right.
and how each tissue responds to the the crisis of apnea.
Right. Yeah.
I couldn't tell you how they all work
Mhm.
at
Yeah,
the
it's
same time.
fascinating. There's so many different aspects of our body that are affected by sleep, like you said. It's just, I think people take it for granted,
Yes.
and when it's such a huge foundation for everything, like you said, and especially during the past, era of our pandemic, we've seen so many areas affected by sleep, or that sleep has back and forth, right? So we've seen the
Mhm.
stress, mental health, like you mentioned, and the immune system. So let's talk about the immune system, another one of my favorites in relationship to sleep. Is that affected? Because I know that they play like they're best friends and enemies at the same time.
They're profoundly affected. Uh, when I was first dating my wife, my father-in-law made a joke and said, everybody has cancer, right? And my mother-in-law got very scared at that statement. She goes, is that true? I
Mm-hmm.
said, at any given time, our body is fighting cancer cells,
Mm-hmm.
a viral infection, a bacterial infection, a fungal infection. And sometimes the infection is controlled via what we call the normal flora.
Mm-hmm.
All our bacteria and viruses and molds in our body kind of keep each other in check,
Right.
right?
Yeah.
And our immune system, our T cells, our B cells,
Mm-hmm.
and et cetera. When we have retarded sleep, we have decreased function in our immune system,
Mm-hmm.
right? Which is absolutely critical in these times that we're living in right now.
Right.
Just getting a good night's sleep is so important. So I would say in a healthy adult, it is more, I would say just from personal experience and anecdotal experience, it is more detrimental to receiving an infection when you have retarded sleep
Mm-hmm.
than with a totally healthy person with a fully normally function immune system being around someone that has it.
Right. Exactly. Yeah.
Yeah.
Makes total sense. And so if you know that you have some changes in your sleep pattern, or maybe you've been even diagnosed with a sleep disorder or sleep apnea, what can you do? Like, are there specific holistic treatments? I know you talked about the plate that you can have made and placed in to help you sleep, but are there other specific treatments that you can recommend? Like, what would be your like top three that our listeners would kind of like, okay, maybe I could start working on that in my home environment.
Well, okay. So it depends. I mean, the first thing is you have to be tested. You
Right.
know,
Number one,
your
test.
your your bed partner is not a good indication
You
of,
snore.
you know what I mean? So it's good that they observe it, but they don't
Right.
know there's a certain amount of snoring and sleep apnea that's within normal limits that we don't aggressively treat. So your bed partner could be finding, when they see it, they could be seeing just a little bit,
Mm-hmm.
or they could miss it, and it's because they're asleep.
Right.
Right? So
Totally.
getting tested is number one, number two, and number three. That's
Right.
the
Yeah,
first
that's
one.
it. Like, okay, one, two, three,
Um,
test.
in our industry, what's considered the standard is what's called the CPAP. That's the
Right.
machine that blows your airway open.
Yep.
Okay. And it has, just so you know, it has a very high success rate. Like, I think it's something like 99.7%, depending on which study
Mm-hmm.
you look at, but a very, very poor adherence rate,
People
right?
don't like to wear it when they're sleeping.
Yeah. So it's got
Hmm.
40% of the time it's not worn.
Right. Or it
Right?
comes off when they're
Or it's
sleeping.
partially, or they pull it
Yeah.
off themselves, or
Right. Yeah.
what have you. Just is a very poor adherence rate.
Mm-hmm.
And when I say adherence rate, the what they call adherence is, to be kind, is bottom of the barrel. Right. So it anyone that treats sleep apnea with a CPAP
Mm-hmm.
wouldn't call it what the minimum value for adherence is as adherence. It's not
Right.
good enough.
Not good
Okay.
enough. You need to be
But
using
but
it
we
way
know it's a
better.
problem.
Yeah.
But we know it's a problem. So that's it. Oral appliance is for adults and children,
Mm-hmm.
is the preferred treatment. For children, the oral appliance is actually a functional orthodontic appliance.
Right.
Usually we're developing the palate or widening the palate, and we're
Mm-hmm.
bringing the mandible forward.
Yeah.
Um, much more, I mean, there are surgical interventions, but that's on a case by case basis. There are what's called myofunctional exercises,
Mm-hmm.
swallowing exercises with the tongue
Mm-hmm.
that can potentially tighten up the tone, because sleep apnea, obstructive sleep apnea, is a neuromuscular tone problem
Right.
that's exacerbated by weight gain, that's exacerbated by enlarged tonsils and adenoids, that's exacerbated by blocked nasal passages.
Poor eating habits.
Poor eating habits. I don't know if we can say that in the context of like the clenching. We could say that,
Right. Yeah.
and if you get swelling and edema, that the weight of the swelling and edema, will make
Right.
the tissues
Like
more
too much
collapsible.
salt or something like that.
The wrong kind of salt. The
Right.
wrong
Right.
kind of salt.
Wrong
You
kinds of
know,
salt and salty
yeah.
foods that aren't good for you.
Yeah,
Yeah.
exactly. Exactly. Yeah.
Yeah.
So there's even research out of Australia, actually about a half a dozen studies the last time I looked. The use of a didgeridoo, right?
Oh,
Which
cool.
is another way of saying a wind instrument that requires circular breathing. Circular breathing is when you inhale through your nose, but maintain air in your mouth. So you're inhaling and exhaling while you're doing the didgeridoo itself. And the amount of muscle tone you need to develop to do that properly will reduce sleep apnea on average by 50%.
That's amazing. Well,
Yeah.
that's a good one if people can learn how to use a didgeridoo.
Yeah, I have a couple from when I lectured in Australia, and let me
Yeah.
tell you, it is not easy.
Right. It takes practice. One thing we didn't talk about, I'd love for you to just talk about melatonin, because, I think there's so many different, like, forms that you can take, different milligrams that you can take. But some people will say, I tried it, it doesn't work. Some people will say, I love it. Other people will say it gives me nightmares. I mean, what's the melatonin doing? I think that's good for our listeners to.
So okay. So first of all, it is an over-the-counter product,
Right.
which really should come with a doctor's suggestion. Okay.
Exactly.
So first off, right off the bat, we should never take more than 3 milligrams at a time.
Right.
Unless we're treating like a Parkinsonian problem, we should not take more than 3 milligrams a night. We should not take it every night indefinitely, because we're essentially telling the body, stop making it yourself. I got it here.
Right. I'm done with you working. So,
Which is a
yeah.
problem. We never
Total
want to
problem.
we
No.
never want to do that, right? The recommended dosage for those that need it is between 0.1 milligrams to 3 milligrams. Okay. I always recommend, like when I do it myself, I am usually taking a liquid version that's sublingual,
Right.
that you put it underneath your
I
tongue.
like that form too.
Yeah. We need melatonin in our sleep. More important than melatonin is the factors for maintaining our circadian rhythm, which
Right.
is making sure we're not getting too much light.
Yeah, exactly.
So when I get home, I wear glasses that block like 65 or more percent of the light in our house.
Right.
And it allows my brain to understand that it's nighttime.
Yeah.
And starts making its own melatonin. Right. And I'm not different than anyone else. I get on my phone at night too. Okay. I'll lay in bed and look at it for a few minutes myself.
Right.
But I always have eye protection.
Right. And you're talking about the blue blockers?
The blue blockers.
Yeah.
Exactly.
Yeah. I just
And
want
the
a pair of
stronger,
those.
the better. Huh?
I just want a pair. I'm so excited to use them.
Congratulations.
Yeah. I was like, yay. Because I haven't tried them yet. And so I'm excited to try
Wonderful.
them out.
It's great. You get used to it very easily. Things that are yellow will look pink when you're looking at it or through an orange lens. It's fine. You get used to it very quickly.
Yeah.
Your
I'll have
eyes
fun
adapt
with it.
Yeah. And also melatonin is a precursor to 5-MeO DMT, which is what our pineal gland secretes during REM sleep.
Right.
Yeah. And we need that.
Definitely.
We need DMT for survival. We need REM for survival. So melatonin is fine. Do it under doctor's supervision. Don't take it every single night.
Right. You shouldn't do that with anything where your body gets used
just
to
with
not
anything.
getting it on its
I
own.
agree. I agree. And just take it, in a controlled manner. And we know, like, we should know our body. We should know our body enough to say, you know what? I definitely need the melatonin tonight. I'm
Mhm.
deprived in sleep, stress at work. I'm just going to take it.
Right.
And we have other nights like, if I just discipline myself to not eat 3 or 4 hours before sleep and not stay staring at like a screen or a
Mhm.
light bulb in
Mhm.
those 3 or 4 hours, I bet you I could get to sleep without anything.
Right. Yeah.
Right.
Right.
And yeah, I mean, there's even like a lot of CBD out there that's very
Mhm.
helpful for
Yeah.
people going to sleep without causing the grogginess that we see with too much melatonin.
Do you think that CBD should also come with that caveat of a doctor's prescription
I
to be,
do.
yeah, I think
I
so
do.
too.
But I want to say something to that I think is really, really important.
Mhm.
There are pharmaceutical grade CBDs,
Mhm.
okay,
Yeah,
that you can only get by prescription from a doctor,
right.
okay? These must be avoided at all costs. Do not take those medications,
Mhm.
okay? The side effects and the other issues you can get
Mm,
from these, synthetically made
right.
cannabinoids
Yeah.
are very dangerous.
Super dangerous to the body.
Very dangerous. Like, so for example, one of the reasons why CBD and marijuana is not dangerous
Mhm.
is that it doesn't cause the breathing receptors in the brain to be altered,
Right.
right? One of the reasons opioids are so deadly is that it does
Yeah.
affect the breathing receptors.
Yeah.
These new pharmaceutical based ones, certainly not all of them,
Right.
will affect the breathing centers, and they can even cause psychosis. They have a
Yeah.
lot of horrible side effects. So I just wanted to make sure people know that,
Right.
because when we first heard, when doctors first heard that there was because when we think of pharmaceutical grade CBD, when you're going from plant to oil,
Right.
one of the things that's so hard to get is consistency.
Mhm.
Having like one bottle the same as the same as the
Yeah.
next from 5 years from
Super
now.
challenging.
It's
Mhm.
very challenging. So when we think, pharmaceutical grade, we think, it's made in a hooded, controlled environment with people in masks and gloves,
Mhm.
and they're going to be diluted in such a way that it's consistent. And we do want natural CBD to be made that way, to be manufactured that way.
Right.
And that's the only kind I would hope that people use.
Mhm.
But the when we doctors heard that you can, you know, get it by prescription, that means we can dole it out. We can tell them too much, too little. They
Mhm.
can get it from a pharmacy. We were so excited. We were so
Mhm.
happy at this. But the research is frankly scary, and
Yeah,
I
that's
and
not
I
good.
wouldn't I wouldn't recommend them. I
Right.
wouldn't recommend them. I would
Yeah.
never it's not even in my wheelhouse to prescribe them. But
Right.
if I was a physician, I wouldn't prescribe them.
Right. And this is something you're, just to be clear, this is a scientifically created CBD that's
Synthetic. It's a
synthetic. Yes,
synthetic.
synthetic CBD. Correct. Thank you. I
Mhm.
couldn't, the word didn't come out. Yeah, synthetic CBD. So it's not, it's just like if you're taking some other synthetic that the
Mhm.
body isn't recognizing as that true plant form, and
That's right.
it's not having the real property of the plant. It's changed
That's right.
the makeup of its original job.
That's right. And the where the rubber meets the road
Mm,
is in the receptors
right.
of our, for the CBD. So I don't know if you know the story about CBD, but I can't, what was his name? The president that was involved with the Vietnam War.
Nixon?
Nixon, I believe
Hmm.
it was during Nixon's time, the government was trying to show how dangerous marijuana was.
Hmm.
And in the process of their research, they found out that almost all our cells have specific receptor sites that are only for CBD1 and CBD2. Okay. So that means we evolved with the plant, just like
Right.
the mitochondria,
Exactly.
and we have the ability to discern what CBD is and benefit from it in a
Right.
positive way.
Yeah. I love the human body. That's so amazing,
It's
right?
so amazing, right?
Yeah.
So the synthetic ones don't operate necessarily on those receptors that we want them to bind with.
Right. Yeah. They're
They're,
binding in a way that is not healthy for the body.
that's right. And so, for example, the THC
Hmm.
in CBD, that, for example, is never, even from a plant source, never to be used on its own.
Right.
It's highly dangerous on its own, even
Yeah.
from the plant. Okay.
Right.
And the plant would never give you THC without CBD.
Right. Yeah.
Okay.
It's not going
You
to come to your
need it.
doorstep
You
like a little
need the
package.
CBD to control the excitatory aspects of
Yeah.
THC.
Mm-hmm.
So when you have the synthetic one, that's somewhere in between THC and CBD, but doesn't give you the protective aspects of CBD, it
Mm-hmm.
starts to become very dangerous, just like natural THC would be.
Yeah. Oh, I'm so glad we talked about that because I think that's really important. You know, I have interviewed a couple people about CBD in general, and I think it's a subject that a lot of people are becoming more aware of. It's becoming more mainstream, but there's so much different information, and people unfortunately, use Google as a way to obtain information.
Well, you know what? You can use Google Scholar,
Right. This
which
is
is
true.
their dedicated website,
Yeah.
and type in like cannabinoids and insomnia,
Yeah. And get some
cannabinoids
good.
and PTSD,
Mhm.
cannabinoids and pain.
Right.
A
Which is good
lot
for
of
all those.
information,
Yeah.
which is good for all those.
Yeah.
And the reason why we think it helps people with insomnia
Hmm.
is if you have insomnia due to PTSD, if you
Hmm.
have insomnia due to pain, which is a very large component, or you have insomnia due to anxiety, well, we know that CBD can positively benefit those three phenomena,
Yeah,
those
exactly.
three diseases, which then can lead to a better night's sleep, right?
Right. Yeah.
Now, also what we see though, so we see for people that are regular users and who have not come to the cause of their insomnia yet,
Hmm.
we see, because their research isn't that heavy on the insomnia part, we see the effect of CBD very similar to the effect of wine and alcohol.
Or
So
just
for
kind of
ex-
small sedated
so
aspect.
it allows us, people who have trouble falling asleep
Hmm.
with wine, they fall asleep easier,
Right.
but they don't get into those deeper stages as much as if
Mm.
they never had the wine,
Right.
right? And
Mhm.
we are seeing that with CBD as well.
Is that because the liver is affected as one of the ways that our body is processing the alcohol when we're drinking, something before
I wish I could
bed?
tell you definitively
Okay,
that,
I'm gonna do research on that.
it's a plausible hypothesis, but I couldn't tell you for sure that's why.
Because we have
But
our, specific, oh, sorry, we have specific hormones that the liver, is communicating with the adrenal system. So I'm just like, thinking about the
well, the
HPA
liver is
axis.
also detoxing, and
Right. It's a
alcohol is
huge,
something
yeah.
that needs to be detoxed from.
That's right. A huge
We
one.
so it could be overloading the liver for that night. I
Hmm.
don't know. I couldn't tell you for
Yeah,
sure.
it's interesting idea,
Um,
right?
yeah, and CBD usually aids in the detoxing pathways,
Hmm.
but then it also gives the liver more work
Right.
to detox. So
Yeah.
it's a complex field which I have some training in, but there's still a lot of unknowns
Yeah,
with
the
it.
body is always filled with unknowns, which
Yeah.
keeps us curious as physicians, right? We're always learning.
Now I will say this. If we have receptors for something, let's say in this case we're talking about CBD, as well as serotonin and dopamine,
Right.
we often have the ability to manufacture and trigger those receptors being triggered,
Hmm.
right?
Yeah. Hmm.
Like you said, through meditation, right?
Right.
But it could even be from recalling moments of when you were in the state. So, for example, someone who's a regular marijuana user, and by the way, I don't recommend this because what I find the reason why people take it on a regular basis,
Hmm.
I mean, obviously, if it's for PTSD, if it's for anxiety, I understand that. And
Right.
like I said, you can do it in a controlled manner. But when I find people smoking it regularly, I often find them doing it to avoid whatever the trauma is, to
Right.
avoid whatever the emotional pain is.
Hmm.
And what they often end up doing is when the marijuana wears off, they become hyper triggered, hypersensitive to their trigger.
Right.
right?
Yeah.
And that causes all kinds of problems on its own,
Yeah, so true. And
right?
when we're smoking something, it's all going into our lungs, and emotionally the lungs are about grief. So, we're taking something in, we're trying to suppress the grief, and it's going to
That's
like
right.
rebound
In
right
Chinese
back at
medicine,
us.
we say that.
Yeah.
As an acupuncturist, I can tell you that that is 100% fact. Now, with the context that I was talking about in people taking it like too much,
Hmm.
when they take it, if they can recognize the mental state that they go into, the desirable mental
Right.
state that they go into when they smoke it,
Hmm.
with planned meditation, they can trigger the physiological positive aspects of that state by maintaining that mental state.
Mm-hmm.
You
Yeah.
follow?
Oh, totally. Yeah, that's
Yeah.
great. Yeah.
Yeah. So there is a lot of positive aspects to it. If you can like practice and practice on having that state while you're having, again,
Right.
same thing with happiness and joy,
Yeah.
recalling a wonderful, happy time, a
Hmm.
grateful time, an exciting time. And what you're doing is you're making the past or even the future in the now.
Right.
And you're
Yes.
telling your brain, this is the state I want.
Yeah, that's what I do when I go to sleep. I turn on relaxing music and I do all my
Yeah.
kind of like gratitudes for the day. I'm like, what am I really
Good.
grateful for? And then I think about what I like that tomorrow to be.
That's
What's my
that
vision for tomorrow?
one of my mentors and dear friends, I love him to death. One of his best remedies for insomnia is counting everything that he's grateful for.
Mm, I love that. That's great. Instead of sheep.
Yeah. So easy, right?
Right, yeah, totally.
Yeah.
Oh gosh, Dr. Shirazi, I think we could probably talk for a really long time, but I want to be very grateful for your time this evening. We'll have to have you back on to
I would
talk
love
about
that.
pain and sleep because we didn't even get to brush that topic at all, but I know that that's a really big one, and but we'll have you back on for that one. But one last fun question.
Please, yeah.
Yeah, if you had an unlimited budget, what would
Mhm.
you do to have the biggest impact on the planet right now?
Mental health.
Mental health.
I would put as much resources I could for giving more people that need it access to care for mental health issues. That would be my number one focus right now. There are a lot, and of course, sometimes the mental health is the sleep, sometimes the mental health is the pain, but a lot of times people are dealing with trauma,
Mm-hmm.
and just taking medication doesn't resolve the problem. It just lets us to cope with the problem.
Right.
I would like to have more and more therapists, more and more people that are focused on PTSD treatment. There's a
Mm-hmm.
wonderful technique called havening. It spells like have, like HAVE, and then
Mm-hmm.
ing. And they even have self-havening. You can look at this technique on YouTube. But I would make sure that more and more people have access to this kind of care. When we have good mental health, we make better decisions for
Mm-hmm.
ourselves and the people in our environment.
Right.
We make better decisions for our spouses and partners, our children, our coworkers, our employees. All of it is benefited by having proper mental health.
I love that, and it's so you're 100% right on with that. I think if we can have that mental health piece, we'll see it changing so many people, but also like it trickling out into all their environment, their family, their children, their loved ones, and
Mhm.
that community of mental health is so important for that next stage on our planet as we're discovering as we're
That's
moving
right.
forward.
Yeah.
Yeah. Well, thank you again for taking the time today. I really enjoyed our conversation.
Me too. Thank you for having me. I look forward to the next time.